Hello, my name is Federico Gonzalez. For the last few years, there has been a great increase in the interest in female genital rejuvenation. For this reason, we have developed a practice here at Premier Plastic Surgery which caters to women who wish to have this performed. I'd like to go through a few issues and concerns of patients which may give them a sense of what this procedure is all about and what results to expect.
Dr. Gonzalez, do you use a special no-scar technique for labiaplasty? Some surgeons will just remove the excess tissue and the scars will run down the length of the labia. Will this leave unnatural scarring?
I've developed a unique procedure which addresses these issues for patients. The custom flask labiaplasty, which I developed over the last few years, leaves a very natural appearance of the labia after the surgery. Scars are virtually invisible once healing takes place. They are placed in areas that are not seen and where the healing is such that when the patient fully heals, there's no evidence of the scar.
Is it recommended to undertake this type of surgery if I've not had children?
The custom flask labiaplasty does not affect any particular areas which may be problematic later on during pregnancy or childbirth. Some patients, though, are somewhat sensitive to the hormones to which they're exposed during pregnancy, and so consequently they may have an increase in size of their labia. That has to be addressed on an individual basis.
What kind of anesthesia can be used in labia reduction surgery?
The technique that I use is very demanding, and so patients are on the operating room table for 1.5 to 2 hours in each case. Because of that length of time and because of the sensitivity of the area, it's my recommendation that the patients be under general anesthesia for the procedure. I've not had any problems in the hundreds of cases that we've done with anesthesia for patients, and I think that that provides the patient with the greatest safety and the best result overall.
Is it better to have labiaplasty done at an early age if there is a need, or is it better to wait until one gets older?
There doesn't seem to be, in my experience over many years, any significant change in the results in performing labiaplasty early or later. We have many patients who find this as a severe problem as far as comfort or appearance is concerned, who do extremely well with labiaplasty in early age. That is, in the early young adulthood or late teen years. There are other patients who've had the problem for many, many years who undergo it at a later age, and they too seem to have great success and a great appearance at the end of the procedure.
Would there be a rough edge on the labia when the labiaplasty is finished and healed?
One of the advantages of the custom flask labiaplasty procedure is that it restores the normal labia minora edge and appearance with the procedure, so that it's a normal appearing edge and no scars on the edges of the labia minora when the patient heals up. And this is a distinct advantage of it, leaving a very natural appearance from this procedure.
Could labiaplasty surgery cause decreased or increased sensitivity?
Labiaplasty surgery with the custom flask technique is designed to avoid any injury or trauma to the nerves that supply this very sensitive area. Consequently, there is no change in feeling in that area.
Is the skin around the clitoris involved in the procedure?
The skin around the clitoris is involved in the procedure only when that is a problem for the patient. There are many different types of labia labia hypoplasia and many different appearances with which patients present. So the custom flask labiaplasty is designed to treat each one individually as far as the areas of need. In some patients there is excess tissue in the clitoral area, and this is addressed with this custom flask labiaplasty.
Is the clitoral unhooding procedure as involved as the labiaplasty procedure?
The clitoral unhooding procedure is a separate procedure, but the technique which I designed, the custom flask labiaplasty, can address the clitoral hooding in the same procedure without any significant number of added scars. So consequently, it lends itself to being performed with a labiaplasty when the patient desires it. Each patient is evaluated separately to determine if the excess tissue in the clitoral area is a problem as far as sensitivity or as far as appearance is concerned. And the patient herself guides me in doing the surgery as to exactly how it is performed and exactly which areas are to be addressed. But the clitoral unhooding procedure, it can be done simultaneously or independently and provide great results with no change in the feeling in that region.
Can I have an asymmetrical labia fixed to appear like the other side?
Yes, that's one of the advantages of the technique which I've developed. Measurements with a measuring instrument are utilized to design the flaps that are utilized to create the final result with the labia minora. Since measurements are used, a very good symmetry can be gained, and asymmetrical labia minora can be addressed and treated, as well as symmetrical hyperplastic labia minora.
I've read that after labiaplasty, a woman can experience lifelong sexual arousal problems. Is this true?
I've done hundreds of these procedures, and no patient has had any interruption or change in their ability to have feeling in the genital area. The patients who undergo clitoral unhooding can have an increase in feeling, but it is not a problem as far as pain or discomfort for them. It usually is an enhancement in their feeling in that area and their sensual response in that area. So in short, we've never had a negative result as far as feeling in the genital area with this procedure.
Is it possible to inject fat around the vagina?
Well, the fat injections are for patients who have depletion of the labia majora. This is the outer lip area in the perineum. And we find some patients, particularly patients who have gotten up into their fourth or fifth decade of life and have had children, have some depletion in that area and wish to have it filled. That can be done with fat injection, and it is a very successful technique, but the patient has to understand that that's the appearance that they want of a fuller, plumper labia majora region.
If dissolvable stitches are used, when do they typically dissolve?
The dissolvable stitches that we use are dissolved by the body between 2 and 4 weeks after the surgery. That gives enough time, that gives enough time for them to provide closure of the stitch lines with good healing and allows the result to take place without having to manually remove stitches in this sensitive area.
A fatty mound of tissue bulges out from my pubic region, giving me a more manly appearance in underwear and form-fitting clothes. I'm told it's my mons pubis. Is there a way to liposuction this area?
The mons pubis area can be treated with liposuction. In some cases, when patients have abdominoplasty performed at the same time, it can be directly excised. But most commonly we perform liposuction in this area with very good success of flattening that area and giving it the appropriate appearance that the patient wants.
What types of pre-surgery visits or consultations are necessary?
Our staff is very well trained in dealing with patients who have this problem. They're very sensitive, understanding, and know the questions to ask and the information to obtain from patients. I visit with all my patients before surgery at our consultation meeting and do a full examination and go over all the information important to the patient. After that, we make plans for surgery, and patients can undergo the surgery having had all their questions answered at their consultation meeting. If a patient has further questions, I'm glad to meet with them another time and answer those questions specifically. We try to ensure that all patients have a full understanding of the procedure and all the information they want prior to them undergoing surgery.
How soon after surgery can I resume normal sexual intercourse?
In virtually all cases, sexual intercourse can be resumed without any problem or difficulty at approximately 6 weeks. We have a distinct schedule for patients so that we allow healing to take place, so that we allow the swelling to diminish, and for the stitch lines to be strong enough for them to resume all activity by 6 weeks.
I would specifically like to know if vaginoplasty and labiaplasty can be done at the same time.
Yes, this is a common combination of procedures that we perform here at Premier Plastic Surgery. The patient is fully evaluated for both procedures when they indicate that that is their desire, and the two procedures can be well performed together without any risk to the patient or any long-term problem in performing them at the same time.
I've read about different labiaplasty surgical methods. As I understand it, there are differences in the procedure and the results. Can you explain this to me?
Yes, there are many different types of procedures for labiaplasty. And when I first began to perform this operation approximately 15 years ago, I went and researched some of the existing operations. I was unhappy with them, and over time have developed a specific operation which addresses what I see as the major problems for patients who present with this. Those problems revolve around the fact that each individual is different, and they may have hypertrophy in the labia minora areas either in a vertical dimension or horizontal dimension. To address those problems, to minimize the likelihood of stitch lines being evident, and to give a very natural appearance, the custom flask labiaplasty was developed. We have done hundreds of these operations now, and it really seems to give a great result with an extremely low complication rate and an extremely high satisfaction rate. The procedure is performed in the operating room under general anesthetic, but the detail and care that is taken to perform the operation results in the patient being able to go home and not have to worry about any significant problems in the long term, gaining an excellent result by the end of the healing term, which is 6 weeks. So I think that this is a procedure which has been developed over time to give a great result for all patients, and we've had great success with it. Thank you for taking time to watch this interview. I think that the custom flask labiaplasty is an excellent operation for patients who have this as an issue or problem, and we would be glad to visit with you at Premier Plastic Surgery and answer all your questions in person or provide you with the opportunity to gain information about this procedure.